Hi, it is I again, and I wanted to take this opportunity to offer you a brief introduction to this new methodology called motivational interviewing. It is kind of what I call it a new kid on the block, meaning it hasn't been around for all that long and was developed originally to help addicts and alcoholics. And God knows we need something there. The statistics on successful recoveries are really pretty dismal, even after a 30-day treatment. I worked with addicts, alcoholics for 7 years, and seven of the best years of my professional career. I'm very grateful for all the experience I had there, and it was just absolutely wonderful. But I have to tell you, had I known more about motivational interviewing then, I would have been a much better counselor. To put this in context, the old way of working with addicts and alcoholics it could be summarized in a word, and that word is confrontation. Basically, it has been said that denial is not a river in Egypt. It is the main mechanism used by addicts and alcoholics to defend against giving up their disorder, giving up their disease. And boy, did I and we run across a lot of that. I can remember one session or more that I spent arguing with an alcoholic about whether he was in fact an alcoholic. I gave him this AA questionnaire. I said, take this test. The result clearly showed he was an alcoholic, but he didn't believe the test. So, and I have to say that I don't think I helped him at all. Maybe I put a chink in dented his armor a little bit, but certainly wasn't all that helpful to him. And I think that was the rule back in those days. I never thought confrontation was a particularly good approach to work with these people, although that's what we did. In one facility where I worked, we had a technique or a counseling session, if you could call it that. We called it teaming. When a patient was about to leave against medical advice, a bunch of us counselors and therapists would gather around as many as we could get into that room with that patient while he's packing his or her suitcase and try to convince them to stay in treatment, because good things happen because you're going to be staying sober. And they would say almost universally, oh no, I've got this program now. I'm going to, get home, get a sponsor. And probably, and we heard this from a few of them, basically that they would relapse on the plane on the way home. They would drink on the plane on the way home. So how effective was our treatment? Well, you could say, and we did, that often it takes many, many treatments for a person to kind of get it, so to speak. One of my patients actually had 50 inpatient hospitalizations. I remember him in particular. That's an astounding number when you think about it. And so into that context comes motivational interviewing, which is a much more gentle and guided approach. It's not an in-your-face approach. It doesn't confront, it just gently suggests or leads, basically. It's somewhere between the absolutely directive stuff that we used to do, which would be, for instance, go to an AA meeting. You need an AA meeting. Versus, just sit back and do nothing and reflective listen the way Carl Rogers did. There is a lot of reflective listening, by the way, in the video you're going to see, and the correct answer to the question, who does this therapist most remind you of, is Carl Rogers. There's no doubt about that. You'll probably get points off unless you put Rogers. So there's a clue. Motivational interviewing is much more gentle, and I think it's a contribution to the field as follows. It takes what Rogers does, but goes one step further. It's best used in conjunction with the stages of change, and I think you'll be able to figure that out. One of the errors that I made before knowing the stages of change with the aforementioned client was I would suggest that he go to an AA meeting, and he would say, I'm not an alcoholic. And if you learn the stages of change, and hopefully you have or will soon, I'm not meeting him where he is. He is clearly a pre-contemplator, and I am treating him as if he were in the preparation stage and ready to do something, like go to a meeting. The great thing about the stages of change, the more you go into that theory and all the surrounding stuff, you find there are ways to address pre-contemplation, things you should do, interventions for pre-contemplators. Had I known those, I might have been a lot more effective. So this is where motivational interviewing fits in. It's a lot more gentle. It's a lot more, forgiving perhaps. But there's something there that Rogers didn't do. And this is, I think, a great contribution to our field. And you may see it on this video. And if you do, please tell me, because I haven't seen the video in a while. I'm not sure it's there. But Miller said there's a difference between change talk and sustained talk. And we need to pay attention to that difference. You and I are often ambivalent about making changes. And this is where the stages of change comes into play. Basically, we used to label clients in the old days as resistant or unmotivated. Now we can just say, well, they're contemplating or pre-contemplating. And it's a much better way of looking at that person. It's not as derogatory a label. So consider those terms, change talk versus sustained talk. Change talk meaning I want to be different. Sustained talk meaning I really want to stay the same. I don't want to do anything different. And when we make changes in our life, you might find that to be true. There's some ambivalence there. Okay, this is what Miller added to the mix. Take the statement, for instance, I want to change, but I don't know how. That's a mixture of change talk and sustained talk. I want to change, there's the change talk, but I don't know how, that's the sustained talk. What Rogers would have done with a statement like that is probably reflect both sides of it. He would say something like, well, you're interested in being different, but you're not quite sure how to get there, or something like that. Rogers would get both sides of that sentiment, so to speak. What Miller does, and I like this very much, is he ignores the sustained talk. So the client says, I want to change, but I don't know how. Instead of just reflecting the whole thing, Miller will say something like, tell me more about how you want to change. Now, it might seem simple, but it really bypasses a lot of the non-productive stuff that goes on in counseling. It will be non-productive in my theoretical example, I would suggest, to get the client to tell you how he really doesn't want to change that much. It will be more productive to get him to tell you about how change would be beneficial. So watch and listen for that. And the other thing that you might consider is that the rapport Miller develops with this guy. This guy, if I was treating him, the client you're going to see on the Miller video on motivational interviewing, this guy would have had me for lunch. One of my students who saw this video said, that guy's a real jerk. And she's probably right. He's a real know-it-all. And, we therapists think that we know it all and we don't want our clients to know it all. Otherwise, why would they be our clients? Well, the truth is some of our clients are jerks, and that's why they're clients. And we still should be helping them as much as possible. So yeah, he's a know-it-all, and he and I would have battled back and forth about, I would have said, you have this problem, and he might have said, no, blah, blah, blah. Especially because in those days we were taught to treat alcoholism above all other addictions. So I think what Miller does here is subtle. And if I don't tell you to look for it and watch for it, you might miss a lot of what's going on. He's building a rapport with this client. Notice particularly the end of the session. The client seems to indicate he's really interested in being interviewed again. Welcome to Motivational Interviewing.